Welcome to Module 2 of CNA eMD documentation. We will now look at your intake and output record flowsheet. You will access the flowsheet as shown in the prior module by single-clicking once under the flowsheet selection in the Options panel on the Flowsheet tab. We are choosing the intake and output record, and we will start by adding a single time column as shown prior as well. Right-click, Add Single Time Column, correct the date and time, and then right-click in the date and time of the column you created and edit the text. You will type in CNA, click OK, and now you'll have a time column to document to. You will never document in the top 3 rows or the yellow or green columns.
These rows and columns are for auto calculation. Scrolling down to the oral parameter, the liquids parameter will allow you to input anything that the patient has drank. This includes water, juice, tea, coffee, anything that has not been separated out on its own. Your meal percentage is in the quarter percents, and then you will document to the assistants with feeding, whether they're self-assist, partial assist, and so forth. Down into the output area, you will note that there are 2 areas for urine output. Voided mLs is anything we're measuring, and voided count is the patient is voiding on their own or it is a diaper count. If the patient has a Foley catheter, it will have its separate parameter to document to. The same rule applies for the GI area, for mLs, and for counts. If the patient has any type of drain, the RN will need to add the appropriate parameter for you so that you can document the output for these drains.
You will then save your documentation. You will notice that it starts to tally for you. In this next screen, you will see that now we have a specified liquid, which is a glucerna shake, and then we will also have a specified GI, which is our drains. Either of these need to be added by your nurse. So if your patient has an extra intake or output measure that you don't see on the flow sheet, please ask the nurse to add it. They are the only ones that have the rights to add new parameters to any flow sheets. The final flow sheet is your assessment and intervention flow sheet. This is what you do and see with the patient. It's very lengthy, but as a CNA, you only have certain areas that you can actually document to. Again, you will choose the correct flow sheet from the left-hand side in your options panel, and you will add a single time column by right-clicking, choosing the correct date and time, and then editing the top of the time column so that we know who's documenting. Once you click OK, there are several parameters, which are the blue headers, that you can document to. The first one we will take a look at is under our safety and falls. And it's actually the interventions. The first one is the WDL for universal falls. This is just an example. WDL means within defined limits. So if you hover over the little blue triangle, you will see a conversation box that tells you what the defined limits are. Your bed in low position, wheels locked, and so forth. You can document that you're applying all interventions. You can also document that they're not all applied and what the exception is, and those exceptions are in the small pick list box below. If your patient is moderate or high-risk falls, the appropriate parameter should be sitting there for you that the nurse has added. So please make sure that you're documenting accordingly. We will never document in the green or any bright yellow. Those are nursing geared parameters. The next area we will document to is under our peripheral neurovascular interventions, which is our anti-embolic interventions such as compression, stockings, or sequentials. So when they're on, you document to them. When they're off, you document that they're off. You don't need to document every time you're in the room.
For the musculoskeletal piece, you will be documenting under the interventions parameter. The nurse will complete a new screen called the Banner Mobility Assessment Tool, or BMAT. Based on this assessment, they will add the appropriate level of intervention, so you will only see levels 1 through 4. You will only document to the parameter that's available. You will document to the interventions, and within this pick list, you're going to be able to document any ROM, position changes, anything that has to do with the safe patient handling plan, and if you have ambulated the patient at all. Make your selections, all of your selections within this field, and click OK. You will also be able to document to any additional equipment used. When you click into this parameter a little bit further down, you will see that you have the option for initiated, discontinued, on or off. And then finally, you will be able to document to any of the toileting that is offered to the patient by clicking into the next field and documenting appropriately from the selection.
Please continue to Module 3 for the remainder of this course.